Medicare is American as apple pie. Medicare parties are happening across the country today, celebrating Medicare's first 50 years and committing to make the next 50 even better.
Welcome to the celebration of Medicare and Medicaid, two of the greatest social safety net programs ever established in this country that have saved literally millions of lives. And Medicare and Medicaid aren't just costly government programs. They are people. They are your parents, your grandparents, your disabled neighbor. They might be that friend of yours who's working 2 jobs and still can't afford the insurance for her family. That's why we must protect Medicare. Not everything, even in a capitalist society, has to be based on profit. Some things are a public good, not a consumable good, and health is one of those types of things. There's plenty of money in this system. It's about reallocating those dollars and making sure they go to actual health care. People should get the health care they need when they need it, not just when they can afford it.
The nurses are the ones who not only look after the health of individual patients, and all of us are patients at some point or another. You know, while the doctors are running here and there, there's somebody in that room taking real care of you, and it's the nurses. And I am so grateful for all that you do. So thank you. We have extended health care to people who never had it. We have made these big insurance companies more accountable. But in my heart of hearts, deep down in my heart, I am now and will always be a single payer person.
We know that people suffer, and we know that people's lives are in danger without having adequate health insurance. So that's why we're here tonight. We that are in the health professions, we came into this profession so that we could care about our patients and care for our patients. And we can use Medicare as a great example of a single payer model with decreased administrative costs, improved efficiencies. The important thing is that we as physicians and nurses and other health professionals can begin to care even better for our patients without these incredible barriers that they face.
But what have we learned? We've learned that every single person deserves to have health care, and we've learned that especially when you are 65 and older, or if you're disabled, you shouldn't have to worry about whether you can afford health care.
I've been for single payer for 20 years. And I'll place my bets. Once people get another whiff of private insurance and what that sets them up for, and all the exclusions and exemptions and all the things that are hidden in those policies that they don't find out about until they or their families need it. Once they find that out, it's going to be single payer. And so that's the way the private sector works on these things. On one hand, all these threats about all the inefficiencies. On the other hand, they want the subsidies. They want to put in whatever prices that we have to pay out of our pockets, and then they complain about the cost of health care. Well, it's a blatant hypocrisy, and the Republicans in Washington and the Republicans in Minnesota are the ones that back them all the way and let them get away with this garbage, and we ought to darn well tell them, pay for it yourself. And keep these projects, take this, the only way we're going to get this only will be single payer.
Happy birthday to you. Happy birthday to